I'm reporting on 5-year-old male Jose Ortiz, who comes in today for a well child visit with his mom. They also do have an interpreter at their side. He comes in for a well child visit prior to starting kindergarten. Also, mom complains of increased urination for the past 2 days, voiding about 12 to 15 times a day, and crying and complaining that it hurts to go to the bathroom. Mom says he is going frequently, but not voiding large amounts. And has also noticed some mucus in his urine today. He does have a history of enuresis, but he's no longer been wetting his pants during the day, only about once a week at night. He's also had a dry cough that started about 6 months ago. Cough is worse at night, waking him up about 2 nights a week, and it states that it does hurt his chest to cough. It is aggravated by increased activity and worse when he plays. It is relieved some with albuterol inhaler, which he's been using about every 4 hours around the clock for the past 3 days. Past medical history, he does have a history of asthma, which was diagnosed in 2010, some seasonal allergies, and the enuresis. No known drug allergies. Currently, he is prescribed Flovent, 2 puffs BID, although he's not been taking that routinely, and also some albuterol, 2 puffs Q4 hours, PRN for coughing and wheezing. Immunizations are up to date. As far as his nutrition, he does eat a well-balanced diet with a variety of foods, not a whole lot of sports drinks or sodas, 1% milk, and only eats sweets like at birthday parties. Physical activity, he enjoys playing outside a great deal, and also enjoys playing soccer. Home is safe as far as no firearms. He does use a booster seat and a bicycle helmet and that type of thing to prevent any injuries. He is up to date and within his milestones with the growth and development. He can write his name, knows his age, address, is able to ride his bike with training wheels, counts to 10 in English and in Spanish, knows his colors, and is able to recite the alphabet in English. Parents do report some marital problems that may be an issue. We'll kind of keep that in mind as we progress through the next few visits. As far as the physical exam, he is 108 centimeters long, weight 18 kilograms, both falling within the 50th percentile. Temperature today is 100.2, respirations 25, pulse is 100, blood pressure 106/68, and his O2 stats are 98% on room air. As far as the physical exam, everything is unremarkable except for the lungs exam and chest, which I do hear some expiratory wheezing bilaterally on auscultation with decreased air movement bilaterally, like I mentioned. No retractions, nasal flaring or grunting. Chest is symmetrical, and there is a dry cough noted during the exam. For the assessment, 1, I'm going to do routine infant child exam. 2, acute asthma exacerbation. 3, urinary tract infection. 4, enuresis. And 5, family disruption. Medications, I'm going to go ahead and give him a nebulizer. Albuterol treatment today in the office. I'm going to have him continue the albuterol, 2 puffs every 4 hours as needed for cough and wheezing. Flovent, I'm going to encourage them to use that as prescribed using 2 puffs BID. We're going to start some Prelon, 15 milligrams per 5 milliliters, 1 teaspoon BID for 7 days. And also we're going to start some Septra, 90 milligrams PO BID for 10 days for the urinary tract infection. As far as labs and testing, today we're going to make sure we go ahead and do the pulse ox, spirometry, consider allergy testing since the asthma symptoms seem to be worse and could be contributed to certain allergens. We're going to send his culture for a urine insensitivity to make sure that he is on the correct antibiotic. As far as his asthma, we want to make sure they do have a plan in place to make sure they are understand what to do if he does have an asthma attack or starts having some complications. Support the parents and give as much information as we can and resources that there are available out there. If he does continue with the enuresis older than 6 years old, we may want to refer him to a behavioral and motivational therapy or start some medications for the enuresis. Mom does need to be educated on the signs and symptoms of exasperation, just so she is aware of when to seek additional medical care. And I want to remind her that even though he may go some months without any symptoms at all, that it is still very life-threatening. He needs to keep the rescue inhaler with him at all times, and to be aware of the signs and symptoms to look for. For the urinary tract infections, I'm going to have them increase water intake, frequent complete voiding, proper hygiene, avoid bubble baths, perfume soaps, decrease intake of caffeine and carbonated beverages, citrus, which he is not really reporting that he takes in a whole lot of that. And as far as follow-up from this visit today, I want them to follow up by phone in 24 hours and then return to the office in 2 weeks, and then every 6 months to reassess for asthma control. Once the asthma is well controlled for at least 3 months, we can kind of step down the visits. But at the 2-week visit, we want to repeat a UA and culture to make sure that the urinary tract infection is cleared up and that's been taken care of. As far as health maintenance and anticipatory guidance, we want to make sure that Jose is prepared for kindergarten. Just talk a little bit about the routine and experiences that he may go through at school, and also, discuss with mom that it may be stressful new environment, but just encourage that it is an exciting adventure that they're getting ready to begin. Continue the nighttime routine to minimize stimulation before bedtime. Try to avoid drinks or anything too soon right before bed as well. Continue to enforce using proper safety equipment. Wear his helmet when he's riding his bicycle. It's important to make sure that mom and dad do understand to maintain the rules and expectations and kind of stick to it and be consistent. Especially since he will be experiencing these changes going through at school. Also want to make sure that he does stay up to date with his dental visits and make sure that he's going at least twice a year. And other than that, I think that they have a pretty good thing going on here, and we will just continue to monitor him and follow up at his next visit in 2 weeks.